Hello, everyone, and welcome to RMD All Things Aesthetics and Wellness Podcast with me, your host, Dr. Deborah Durst, and my co-host, Faraday.
Hey guys, Faraday Golombiewski, nurse practitioner here at RevitalyzeMD.
So today is Halloween officially, and we probably normally wouldn't have done some costume type of thing, except it is actually Halloween. Not just the weekend, which everyone celebrated, but it's actually Halloween. So we thought we would dress it up a little bit.
Absolutely.
I'm kind of being Faraday, actually, you know.
And I was already Dr. Durst once last week, and my wig got a little crazy. So today I'm just a witch.
Yeah, well, so I thought you were going to wear a costume, girl.
It's just my norm. I play it well.
That's why I wasn't wearing it. No, but anyhow, so today we're going to talk about ways, you know, a newer method of weight loss that is very effective at weight loss. And there's been a lot of hype and a lot of talk about it. And we're going to deep dive into some facts related to semaglutide. That will be the topic today.
So we have talked a lot in prior podcasts about obesity and all the negative effects, the comorbidities. We've talked about metabolic syndrome in the past. So definitely you can check out those podcasts. But today we're going to talk specifically about weight loss, reduction of type 2 diabetes with a medication called semaglutide, or name branded as Wegovy or Ozempic, if you're more familiar with those names. Definitely, we are seeing an increased trend in the U.S. on obesity. And it's pretty staggering when you look at it, especially when we look at all the markers of long-term negative effects with obesity. I read a study earlier today while we were preparing today, and it said by 2030, 1 in 2 adults are going to be considered obese, and 1 in 4 adults are going to be considered morbidly obese or severely obese. That is crazy when you think about that.
No, it is. And so again, I come back to, I don't think we talk enough about health, you know, fitness and working out and doing a patient doing their part. You can't go to a doctor and get weight loss and health. That just doesn't happen now. Traditional medicine isn't set up that way. And again, you know, even with all the changes with COVID, we still had fast food open. Like, we haven't addressed the fact that even immune function is poor with obesity, along with lots of other negative effects. And that is one thing that we could have spent some time addressing with a pandemic and all the downtime we had during that. And so we're going to address it today. And again, Wegovy is Wegovy is the name of it, but it started as a once weekly injection, Ozempic, Trulicity, and then they had a lot of weight loss that they had recognized with it. And so then it was remarketed as Wegovy, which, again, we're going to go into that biomarker or hormone that is actually marketed as Wegovy.
So let's talk about obesity. What are some health conditions that we see with obesity? So one of them, Trulicity, Ozempic, are to address type 2 diabetes. So increase insulin production. Along with that, you see hyperlipidemia or elevated lipid panels or elevated cholesterol, cardiovascular markers, hypertension, cardiovascular disease. The list goes on and on.
And inflammation. So you're talking about so many different things. So you have joint aches and pains. I used to work in the ER, and so people would come in complaining of knee pain or back pain, yet overweight and significantly overweight. So we're not talking about small numbers like in the US. Like, we're talking about morbid obesity numbers increasing significantly as well.
Absolutely.
So if you have joint pain and your knees, you know, we're all, like, our skeletons are the same. You know, we're meant to accommodate a certain amount of weight, but the more weight you have on a joint, the more difficulty you're going to have with mobility, with movement, with breakdown of the joint, with osteoarthritis, and again, back pain. So our back is meant to balance our front, right? And so if we have a lot on the front, but we still have the same back, then that throws us off balance. We're going to have back pain. So again, I think the number one issue to address with joint pain, aches and pains, back, knee, is getting somebody well enough to be mobile so that
Exactly.
they can go ahead and do their part. And inflammation is huge with obesity because as we get fat cells, those fat cells are inflamed, and that's the number one cause of all diseases. So high blood pressure, cardiovascular disease, the root cause is inflammation. So we need to address it. Yeah.
I mean, sleep apnea, the list really does go on and on and
Correct.
on.
Yeah.
So if we can reduce overall weight and we can bring down overall body mass index, then we can start to see some of these comorbidities resolve. So it does not mean that if we are overweight and we have developed diabetes, we have developed hypertension, we have developed some of these diseases, that we can't reverse it. Sometimes just losing 5% of overall body mass can make a huge difference between being hypertensive or non-hypertensive, or being type 2 diabetic or not type 2 diabetic. So we can change it. It doesn't have to be permanent if we take action.
Correct.
And that's why semaglutide, I think, has gotten so much publicity, either on news, on Town and Country did an article, or Good Morning America talked about it. I have patients coming and asking about it because they've seen it online. They've read about it. It's on podcasts. It's on the radio because it works.
So I think, again, we have to keep in mind that we will hear about things if they're marketed by a drug company.
Absolutely.
So if there is financial support behind it, you're going to hear about it. And so we didn't hear about vitamin D with COVID and immune support. And we didn't hear about high-dose vitamin C and immune support. But we'll hear about Wegovy and weight loss because it's a manufactured drug company, manufactured pharmaceutical that can be used for weight loss. It is ultimately a hormone in the body, and it's GLP-1. It's an agonist, so that means it's acting on the receptor, and that GLP-1 is actually produced from the small intestine. And so it's really, again, a peptide. It comes down to peptides or amino acid sequences that in amino acids form proteins. And so it's a protein that acts like a hormone. And we've said all along, peptides are amazing, what they can do with the body. Gives the body back a hormone or a neurotransmitter it needs to do what it needs. And that's what Wegovy is doing as a manufactured drug, but it's also what that peptide, that GLP-1 peptide is doing.
Absolutely.
It's giving the body back what it needs. And so therefore, it's going to mimic the hormone that's naturally produced by the body, which has lots of good effects.
Absolutely. So by increasing that insulin production, we can see our blood sugar regulate a little bit better.
Yeah. So GLP-1 is, again, produced by the small intestine, and it is the function of that GLP-1 is to increase insulin production and decrease blood sugar. So it was, again, marketed for diabetes, for controlled blood sugar. And then it inhibits glucagon, which is going to do the opposite. So insulin is released when your blood sugar increases. Glucagon is released when your blood sugar decreases so that it can get production from internally, and then you can kick out glucose into the blood. The issue with diabetes and obesity is that you have increased insulin production, too much so. So your insulin levels rise. So not only are you having trouble controlling your blood sugar because your insulin becomes more resistant, it's too much of it, it's not working, but you also have fat storage. So the other issue with insulin is it's taking glucose into the cell. And so too much of it gets it into the cell, but it stays there. And now you have increased fat production, your fat cells increase, and then again, you have storage of fat. So that's the underlying issue. So you need to control that insulin production, really ultimately blood sugar control, because your insulin is being released due to blood sugar control. So ultimately, that is what this peptide does. Semaglutide is just like Wegovy. It's a peptide. So again, identical in structure to Wegovy, peptide amino acid sequence that acts like GLP-1, which is going to control your blood sugar so you have less ultimate insulin secretion. Is that a lot?
That's a lot, but that's okay. So what happens when we have that? Let's go into that. So what does the body do when it takes that in?
Yeah, that's kind of the science.
That's the science behind it. So what you guys are all listening to is, okay, that's nice. Well, what does that exactly mean? What does that mean for me? How is it going to affect me, right? Because the nerds out there, the medical side of it, we love that side of it. But really what it comes down to is patients going, all right, girl, I'm just trying to lose weight.
Yeah. Does this work? What works?
And so there has been an ongoing study called the STEP program, going through different steps, watching over 5,000 participants and how they are losing weight on semaglutide, on this peptide, by Wegovy, Ozempic, whatever name we want to call it. So what they are seeing is, yes, it works. Significant reduction. And the study is still ongoing. So it doesn't conclude until 2023. And it's actually further going on, not just body fat reduction. It's also looking at cardiovascular markers as well. So there will still be more to come out of this study. But the New England Journal of Medicine did post percentages. So at least we can kind of start to see, okay, well, what kind of reduction in weight are we seeing? And what they have posted.
So again, I think it's important for you to note, like you did prior to us starting this, is again, the FDA recognizes a significant weight reduction of just 5% as being effective. So 5%. So if you're 200 pounds, what's 5% of 200 pounds? 10 pounds.
10 pounds.
So that is effective in the FDA standpoint. Is somebody really going to be happy with a 10% reduction? Probably not. And so ultimately, that's a low number. What I'm saying is, like, again, that's a low number.
That was a low marker for them to meet with this medication because they said 5% is considered clinically significant. So we're always looking for clinically significant numbers. So what they are seeing, and these studies are all over a 68-week period, they're seeing an 86% reduction of 5% in patients overall. But
that's a lot of patients.
That's a lot of patients.
5%, yeah.
So then they broke it down and said, okay, well, what about 10% overall reduction? 69% of patients saw a 10% or greater reduction. And then even further, they looked, okay, well, how many people are seeing more than 15% reduction? And it was still 50%. So half the patients in the study were seeing 15% more in overall body weight reduction. That is massive.
Yeah, no, it's significant. So again, I think that all of this is positive, and we want any reduction in weight to happen. You know, any reduction gives you self-confidence. It gives you some ability back. It gives you the incentive, the inspiration to go ahead and be more active and to do your part, which I think is necessary. So, but these studies do look over a long period of time, 68 weeks. And again, a lot of times you also have to meet almost certain criteria, obesity criteria, to be entered into them. And so I think there is a subset of patients, and we'll talk more about the studies because there's studies to support it. It works. But we want to know, can it be used in somebody that doesn't necessarily meet strict criteria of obesity and maybe want a little bit more weight loss over a shorter period of time, right? So
absolutely.
I think
so this medication is
yeah.
meant to be a long-term medication. That means we are, just like any disease, you don't take blood pressure medicine just to correct your blood pressure and then stop. You stay
There's
on.
no end game.
There is no end. It's meant to be
no end game.
Long-term because obesity is considered a disease.
Yeah.
So we are looking at long-term studies for this particular peptide. However, you can use it short-term.
Yeah. Well, and so again, I think in traditional medicine, we are taught, and I'm traditionally trained, we're taught to put people on medications and never take them off. There's not an end game. And I would, challenge anyone to ask their primary care physician that puts them on a medication, what is the end game? Because if they're not talking to you about nutrition and weight loss and fitness, there isn't an end game because you're using a medication to do a weight or a blood pressure control, for instance, instead of you being more active, bringing your blood pressure down, losing weight. So I think there should be an end game. And that's kind of where regenerative doctors come in and peptides come in. It's not manufactured. Obesity is a chronic intermittent disease. It's a disease in traditional medicine. And it is a chronic intermittent disease. So you're going to go on this, but you're going to meet criteria to do it. So a lot of people don't meet criteria and they don't want to be on it long term, but they just have a short-term goal. Does it work for that? Yes, it works for that. And that's kind of where the regenerative peptide part of it comes in, because if somebody has a weight loss goal and they want to do it over a shorter period of time, they don't want to be on something for their entire life,
Exactly.
they can do a peptide. It's the same exact, composition of the GLP-1 and Wegovy, and do it for a short term in a non-traditional route in regenerative medicine, and have those short-term goals reached.
Yes.
And that is
and help them
game-changing.
maintain a healthier lifestyle.
Yeah.
You don't have to have a BMI greater than 30 or
Yes.
31. You can have a lower BMI, use this short term, help with weight loss, see those overall health markers improve, and then come off of it and not see a rebound in weight like you can with some of the other medications we use for weight loss, like phentermine or HCG or whatever fad diet you want to put in, where we are using a calorie reduction or a very restricted diet or only eating certain things. None of those are sustainable, because as soon as you go back to your natural way of life, your natural ways of eating and your natural lifestyle that you do daily, you're just going to gain that weight back. Okay. Where semaglutide or Wegovy or Ozempic or whatever, you want to put in there, Trulicity, all of them. Yeah. It is functional change. So you're going to start looking at food a little bit differently, eating a little bit differently. So it works to slow gastric digestion. So by slowing gastric digestion, you're going to have a lower appetite. You're going to be fuller quicker. And when you do that long term, you start making functional changes in your habits and your lifestyle choices change. Most patients are recommended to stay on this at least 6 months because we want those sustained habits.
Yeah. And I think, again, so it comes down to how does it work? And Faraday brought up a lot of good things. So we talked about some science, but in simplicity, it's going to affect hormones in the right way. It's going to lower your insulin over time. It's going to lower your blood sugar over time, so that looks healthier, less inflammation, weight loss. But it decreases your hunger. It delays gastric emptying, which means it delays your stomach from emptying, so you feel more full. So you don't want to eat more
longer.
And full longer. So you don't want to eat more. And so does it work? It works. The issue is that when you're doing a manufactured brand, there's some pretty set dosing for that as well in traditional medicine. And then traditional medicine also doesn't give you the tools for you to do your part. In regenerative medicine, when we can use peptides, we can titrate up on a dose. So you can use the lowest dose possible with the least amount of side effects, and we can give you tools as well to, again, being more fit, being more active, and nutrition, which I think is a key component of all of this, because not only is there's a patient component of everything we do, and so that's key. But you're going to lose weight,
and you don't have to. Right now, 2.4 milligrams is the highest, or indicated by the name brand, by the Wegovy and Ozempic. That's how they're dosing. A lot of our patients here are not using anywhere near that amount and are still seeing consistent weight loss and meeting their goals. So we don't need to over-medicate. The higher dose that you take, the harder it's going to be to titrate off.
Correct.
And the higher dose you take, the more negative side effects we see with this medication. So if we can lower your dose considerably, still see positive of the drug, meaning we're seeing that weight loss, we're seeing your A1Cs come down, we're seeing your blood sugars regulate, we're seeing your lipid panels improve, we're seeing your blood pressures improve. Why would we increase that dose?
Right.
There's no need, because this medication does cause nausea in a lot of patients.
It's going to cause GI stuff
in some GI
in some way.
Discomforts. I mean, for the most part, the majority of patients see that. We just expect that, and we educate our patients about that and how to handle that.
Yeah, and using the lowest dose and titrating up if necessary, but also just consider side effects are GI, bloated, I'm constipated, I'm nauseated. I just don't feel right enough of myself. That's pretty normal. If that's not something that you want to exchange for weight loss, then this isn't the route for you.
Absolutely.
But you can titrate up. So if you're decreased appetite, you're losing weight, and you don't have side effects, you don't need to go. We give a titration schedule, but you don't need to go up if it's effective without any side effects, and those side effects will get better with time if you don't titrate, but they're going to come back or get worse if you're potentially titrating. And if you don't have a reason to, then don't titrate.
Exactly.
Yeah. So, and I will say, so one big marker of warning on Wegovy is thyroid issues. And so if you have thyroid issues, it's not really been seen in humans, but it was seen in rodent models that were treated. And so thyroid cancers have increased.
Tumors.
Yes. So if you have anything questionable in your thyroid, that would be a reason not to use it. But again, in traditional medicine, you're talking about long-term intermittent disease, long-term intermittent treatment. And so if you're using it for a short term, for a goal, you may not get those effects, but that is definitely a contraindication we still recognize.
That doesn't necessarily mean that if you are on Armour thyroid or MP thyroid or levothyroxine or any of those medications that you cannot use this medication. It just means we need to have a deeper conversation of why we're on those medications and what your thyroid history is and your family history.
Correct.
And then we'll make that decision together on what is best for you.
Well, and that kind of summarizes a lot of what we're talking about with semaglutide. I will just say that we get a ton of inquiries about semaglutide on a weekly basis. Probably one of our most frequent questions that the office approach with, which is why we're bringing it up in a podcast to kind of address some issues. If you have an experience with semaglutide, Wegovy, Trulicity, Ozempic you want to share, please share in the comments below. Again, keep in mind that some of those are traditional and dosed a certain way and definitely higher than you do with a peptide that we can titrate a little bit better. But we would love to hear if there's some questions you want to have answered. Please drop something in the notes and ask.
And like and share, right? Sharing is caring.
Subscribe, like, share, all of the things. And again, we'll just kind of remind you that this is like a Halloween.
Happy Halloween.
Yeah, happy Halloween. And that's why we're kind of dressed like this.
You.
Yeah, that's right. Absolutely. So again, thank you for listening or watching. And we look forward to deep diving into anything aesthetics and wellness. Thank you.
Thank you.